Did you know that beta blockers can make your allergic reactions more severe and more difficult to treat? They can make you sensitive to the sun, making your skin burn more easily, and they can also make you more sensitive to cold temperatures? Let's talk about it. So I've spoken in detail in the past about how beta blockers are able to decrease the threshold for mast cell activation to prime the mast cells, making them more easily activated. So if you have a mast cell activation disorder, like I have chronic urticaria, maybe you have MCAS, MCAD, whatever you have, mastoiditis, mastoiditis, right? Whatever you got going on, is I'm making things up, maybe. I got a dry mouth, hold on. Essentially, if you have a mast cell condition, beta blockers are not always your friend. They can make your mast cell condition worse because, like I said, they decrease the threshold, making your mast cells activate more easily. Especially if you take beta blockers and ACE inhibitors together. That is a very bad thing. So, the use of beta blockers in patients with the risk of anaphylaxis requires really some serious and special consideration because beta blockers directly block many places where epinephrine works to mitigate anaphylaxis. Oops, sorry, my kitty's here. And this means that if you are taking beta blockers and you have anaphylaxis and you need epinephrine, this means that epinephrine may be ineffective, which is horrible. I mean, that could be life-threatening for you. So, not a good thing, right? And I don't know why not enough doctors talk about this. Hold on, let me get this kitty. Just kidding, she's cool. But if you're starting beta blockers and you deal with allergic reactions and you deal with anaphylaxis, especially if you have overactive mast cells, you really need to consider whether or not beta blockers are really right for you because they're going to potentially be life-threatening for you because they may make your epinephrine ineffective. So if you're somebody who deals with anaphylaxis, this could be very dangerous for you. And then another important thing to keep in mind when you're using beta blockers is that beta blockers make your skin more sensitive to the sun. So when you take beta blockers, you are more likely to burn or develop a sun rash or a heat rash while taking them. So you need to take extra precautions when you're out in the sun. Wearing long sleeves, definitely wearing sunscreen. I mean, everybody should be wearing sunscreen every day, okay? Our ozone is not so good anymore, right? I mean, we've all seen Terminator, right? Do you remember? They had SPF 400. Kitty, come on. Making a video. Kitty. But this is serious. When you're out, oh, she moved me. She's gonna block me. Okay. When you're on beta blockers, you are more sensitive to the sun. So you need to take extra precautions and be careful in the sun, okay? I don't know why doctors don't tell people that, but yes, it makes you more sensitive to the sun. And lastly, beta blockers can make you more, I'm gonna faint, hold on, oh man. Wow, I've been so fainty lately. Okay, I think it's my prolonged QT, I'm not sure. Okay, anyways, oh my gosh, sorry. Probably the POTS. Really, probably the POTS. I like to blame the prolonged QT. It could be that too. I mean, that causes fainting. Yay! So beta blockers can make you sensitive to the cold because they can make you get chilly hands and feet. So beta blockers, obviously, they slow down your heart rate, right? They directly act on your heart rate. They slow it down. They stop it from beating so fast. So they slow down that pumping, which causes, slows down your circulatory system, slows down your blood flow, which is going to cause, to feel colder. It can cause you to feel chillier, especially in your extremities. And if you already deal with Raynaud's, dealing with that excessive vasoconstriction in your extremities, you're going to feel quite a bit colder now when you're on a beta blocker and you have that slower blood flow through your body. You're not going to be feeling warmer. When your heart rate's pumping, you're going to be a little bit warmer. But when you have a slower heart rate, you're just going to be colder. So you're going to be more sensitive to the cold. So you need to bundle up more. You need to stay warmer. So if you are on beta blockers, you need to stay a little bit warmer. You're going to be a little bit more sensitive to the cold. sensitive to the sun, sensitive to the cold. Gotta be careful with your allergic reactions. I don't know, I'm not a big fan of beta blockers. I mean, that's why I'm not on them, so, personally. Anyways, I just feel like, I feel like doctors don't really tell their patients about this often enough, so I shall be the one. I shall be the one. I don't think I have talked about this in a few months or so here I am talking about it again. So beta blockers, yes, they can make your allergic reactions worse, more severe, and they can make them harder to treat. So essentially, beta blockers, they are thought to decrease the threshold in which mast cells are activated to prime that mast cell. So your mast cells are more easily activated. So you can have more severe allergic reactions. And beta blockers also, they directly act on the spots which epinephrine needs to act on to mitigate allergic reactions, anaphylaxis especially. So if you're in a life-threatening situation with anaphylaxis and you need to be given epinephrine is going to be ineffective or less effective, and that can be very life-threatening for you. In addition to that, beta blockers, they also make you sensitive to the sun. So you need to protect your skin. You're going to be more easily burned. You're going to get more sun rashes more easily. So protect your skin. Wear long sleeves. Definitely be wearing sunscreen. Everyone should be wearing sunscreen. For sure, protect your skin, 100%. And lastly, because your heart is now pumping a lot slower, you're going to be a lot colder. People with POTS, not everyone with beta blockers has POTS, but obviously, I'm probably talking to POTS people. I got my POTS shirt on. I don't know. Anyways, if you have POTS or if you have a condition, Raynaud's is obviously just super common. You don't have to have POTS to have Raynaud's. Most people have primary Raynaud's, which is most common. Secondary Raynaud's, which is secondary to a condition, is less common, which would be from POTS or something. Where am I going with this? If you already have Raynaud's and you have that excessive vasoconstriction in your extremities, and then you're on a beta blocker, which is going to make your extremities even colder, you're going to be sensitive to the cold, honey. So you need to bundle up, you need to stay warm, you need to be wearing gloves, socks, wool socks. Keep yourself warm because you're going to be sensitive to that cold. Let me know what questions you have. I love you all. Bye!